Good morning. This is Dr. McDaniel at GYN Corner. I'm a board-certified obstetrician gynecologist in New York City, Midtown Manhattan, and I'm coming from the horse farm today in New Jersey, bringing to you all things health-related for women. Thank you for joining me at GYN Corner today. I'm actually coming from the car at the horse farm in New Jersey because I've gotten into the habit of not walking around out in the chilly. It's gorgeous today, really nice and sunny, but I have allergies and I really don't feel like walking around, so I'm going to stay inside today. Allergies have been kicking up for the last couple of weeks, so not easy. And let's see, this is Saturday, so I've been doing the Saturday pregnancy series. And last week I spoke on balloon induction. Just as I'll try to give a 30-second recap if I can. 30-second recap from the last 2 or 3 Saturdays is that on occasion we will attempt to force a patient into labor for various medical reasons. And there is a universal score called the Bishop score, which we use to evaluate the cervix and determine if the cervix is more amenable or less amenable, which we call the ripeness of the cervix, for being induced to allow the lady to start active labor and hopefully deliver her child. The Bishop score is a standard evaluation of the cervix, so we look at how dilated the cervix already is, how soft it is, where it's located, how low it is into the vagina, and how thinned out it's gotten. It's on a scale of 0 to 13, and it's generally considered that if someone's Bishop score is less than 6, then it's not a favorable cervix. If medically she really warrants it, most physicians will attempt trying to induce her because it's not 100%, but it's just the outlook is not so great. If the score is 9 or greater, then it is considered a favorable cervix, and the outcome looks good that she'll go into active labor and eventually deliver her child. The projection is that she will go into active labor within 24 to 48 hours of induction. Now, last week I spoke about balloon catheter induction, where we place a balloon into the cervix to stretch and dilate the cervix and start synthetic oxytocin, which is Pitocin, to induce contractions, dilate the cervix. This week I'm speaking about artificial hormones called prostaglandins. Now, everyone has naturally produced prostaglandins. We call them prostaglandin E2 or prostaglandin E1 and E2. And they have been synthetically produced also. So just as the hormone that comes from our pituitary, oxytocin, has been synthetically produced, so we have Pitocin, the prostaglandins from the cervix, from the amniotic lining, and from the intestinal walls. Those have also been synthetically induced or produced, and they're called prostaglandin E1 and prostaglandin E2. E1 is called dinoprostone. Sorry, allergies. And E2 is called dinoprostone, and E1 is called misoprostol. Excuse me. And congested. The trade names for those are Cervidil. They have a whole bunch of other Cervidil, Prepidil, a few other ones I'm sure, and Cytotec. Now, the Cytotec, it has actually, we consider it off-label to use it for cervical induction, but it's been used for cervical induction. And prostaglandins have been used for cervical induction since the 1960s. And as I said last week, the Foley catheter since the 1800s. But the chemically produced prostaglandins and usage for labor induction have been used since the 1960s. And I know for a fact that I used the prostaglandins. That's the girl's old horse riding teacher passed by, for over 30 years now. So the misoprostol has been used for cervical ripening for about 30 years, but it is still considered off-label. The medication was initially produced to help treat gastric or stomach ulcers, and then it was used off-label because we know that it could allow for cervical ripening, softening, and dilatation. So most commonly, if the Bishop score is really low, it's 3 or less, most physicians will use the prostaglandin E2, which is the dinoprostone. That just seems to work a little bit more gently and slowly to really soften. It increases uptake of fluid and water, breaks down a lot of the collagen bands in the cervix, so it just really softens it and kind of mushes the cervix up and allows it to be more pliable. And the Cervidil or the dinoprostone is used by itself to soften and moisten the cervix so it's more pliable. Once the cervix seems like the Bishop score is around maybe 5 or 6, then most physicians will switch to the prostaglandin E1 or the misoprostol. That one doesn't just cause the softening and the ripening of the cervix, but it also causes contractions. So if you give it too soon, oftentimes you'll note that the patient starts to have contractions too quickly. We call that hyperstimulation, and then it's going to cause problems with the blood flow through the placenta, and you're going to see the heart rate of the baby drop. So then you have to stop, pull out the little, it's a little tablet that's cut into 4s. You have to fish out and pull out the tablet in the vagina, and then turn her on her side, give her oxygen and fluids, all this stuff to bring the blood flow back into the placenta, and then which will obviously get the heart rate back up. So the best thing to do is to start with the gel so that it slowly ripens and softens, and then to move onward with the misoprostol so that it continues to soften, ripen the cervix, and then start the contractions. And then really, once the Bishop score is greater than 6, especially if it's like 8 or 9, then you can start Pitocin, which is just going to really get the contractions stronger and push the head down to the cervix so it's better well applied. And the head really acts like a ramming board on the cervix, so it really just pushes the cervix open. And if one follows that protocol, approximately 80% or more of women will go into active labor, and they will eventually deliver their child. So I hope that's been helpful information on the prostaglandin induction route for cervical ripening and induction of labor. Thank you for joining me here at GYN Corner from the horse farm, Baymar Horse Farm in New Jersey. Where are we? Morganville, New Jersey. Thanks again. Have a great rest of your weekend.